This is back routine 2, where we'll be doing 2 minutes of knee sways, 1 minute of knee to chest on each leg, 1 minute with both knees to chest, and then we'll be sitting up to do a straight leg stretch, again up to 1 minute on each leg. We're doing these exercises lay on a back. You're okay to lie on a bed. You can go on the floor on a yoga mat. Just find somewhere where you're comfortable and safe. Maybe place a pillow under the head just to make sure your neck doesn't get too sore. We're going to slide both feet in so the knees are bent. And then we're going to start gently dropping our knees over to one side. Then we're going to draw them back up and drop them gently over to the other side. And just keep working into that movement, taking the knees side to side. All we're looking for is, as the knees go over, to get a gentle lift of the pelvis so we're getting some rotation into the lower back. If it's sore, don't go as far, so don't push it. Just allow the knees to sway from side to side so we're getting some gentle movement, just slowly loosening off that lower back. Doesn't matter how far you go. Everybody's different, so some people, the knees will go all the way to the floor. Some people, their knees only might move 20, 30 degrees. That's fine. The end result should be the same. So we're going to keep doing this for 1 more minute. If it does start to feel a little bit easier, then by all means go a little bit further down. But if it starts to get sore, either back off or stop completely. Just another 30 seconds. Fifteen seconds more. And then allow the knees to settle back into that central position. So the next movement we're going to do, we'll start with the right knee. We're going to draw that knee in towards the chest, place both hands on the knee, pulling it in nice and snug. And with the left leg, if it's comfortable doing so, we're going to take the foot away from us so that we're straightening out the left leg and gently pushing that left knee downwards as we draw the right knee in. And we're going to stay here for up to a minute. So again, if it feels sore, back off. If it feels too easy, draw it in a little bit firmer. Staying here for another 30 seconds. And then allow that foot to drop back down onto the floor or the bed. And then we'll repeat that on the left side. So drawing that left knee in towards the chest. Both hands go onto the knee, pulling it in nice and snug. And then you can stay here, or if it's comfortable, you slide that right foot away. So that right knee is pushing down into the floor or the bed. And again, we'll stay here for a minute. As before, if it gets too sore, allow it to ease off or stop. And if it feels okay, draw it in a little bit firmer if you wish. Just another 30 seconds. Fifteen seconds left. And then allow that left knee to release, drop that left foot back down. And we're going to slide the right foot in, and then if you're comfortable doing so, we're going to draw both knees into the chest. You can draw them in together, or if it's a little bit sore, you can always bring them in one at a time. So supporting each knee with each hand. And again, we're going to stay here for up to a minute if you're comfortable doing so. And again, if it feels sore, ease off or stop. If it feels comfortable doing so, draw both those in nice and snug. And if you wish, you can draw that head up slightly towards the knees, but again, don't force it. "30 seconds more. Just 15 more seconds. And then gently allow the feet to touch back down, releasing the hands and the neck. Just settling here, relaxing for a few moments. Now moving into our straight leg stretch. Sitting on a chair, edge of the bed, settee, wherever's comfortable. Sitting with a reasonably straight back, we don't want to be too rounded. And then we're going to slide the right foot away until the right leg's straight. Now if your hamstrings are particularly tight, you may struggle to get the leg straight, so don't worry if the knees bend. So long as you can feel the stretch in the back of the leg, that's fine. We're going to keep the ankle relaxed. If we bend the ankle up, it tightens up the nerve and it can make the stretch quite uncomfortable, especially if we've got lower back problems. So with the leg straight, the ankle relaxed, we're going to hinge forward from the hips, nice and slow, until we feel a pull in the back of that leg. Now you may feel it in the hamstring, you may feel it as a burning in the back of the knee, you may even feel it in the calf. That's fine, so long as it's not too sore. I'm going to stay here for a minute. With this stretch, it can be quite nice to focus on the breathing. So if while we're stretching, we take a deep breath in, as we're breathing outwards, we may feel that the tension in the leg eases, and we can gently follow that out breath forwards. So just stay focused on that breath. We'll stay here for another 30 seconds. Again, if it gets particularly sore, especially if there's severe pain into the back of the leg or the lower back, you either ease off or stop completely. 15 more seconds. Then just gently draw yourself up out of the stretch. Allow that right leg to bend. And we'll repeat that stretch on the left side. So again, left leg straight, relax the foot, sit nice and straight with the back, hinge from the hips, coming forward until you feel a pull into the back of that leg. And again, we're going to hold here for a minute. So it may feel tighter than the other side, it might feel easier. Stay focused on the breathing, and again, deep breath in, breathe out, follow that stretch forward. seconds. Again, we won't be here for another 30 seconds. This stretch is particularly nice once you've learned it and you know it. Sometimes rather than timing it, you can maybe just do 5 or 6 breaths. Another 15 seconds. And then just gently easing yourself up out of the stretch, sitting straight and sliding that leg in. If you're comfortable doing the exercises, they can be nice to do 2 or 3 times daily. If you feel particularly sore afterwards, or even the morning after, it may mean that you need to do it a little bit less, or perhaps not be quite so vigorous. If they feel particularly therapeutic and you're not getting a huge amount of after pain or stiffness, then you can build up to doing them 5 times a day. But it isn't a case of no pain, no gain. It's important to stay within your comfort zone and just find that edge of comfort, which hopefully will make that comfort zone a little bit bigger, but without causing undue pain. Any questions, just let me know, give me a ring or a text.